Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
The cervix of a 15-year-old prima gravida client admitted to the labor area is 2 centimeters dilated and 50% effaced. Her membranes are intact, and contractions are occurring every 5 to 6 minutes. Which of the following should the nurse recommend at this time? 1. Resting in the right lateral recumbent position. 2. Lying in the left lateral recumbent position. 3. Walking around in the hallway. 4. Sitting in a comfortable chair for a period of time. The correct answer is 3. Most authorities suggest that a woman in an early stage of labor should be allowed to walk if she wishes, as long as no complications are present. A 24-year-old prima gravida client in active labor requests use of a jet hydrotherapy tub to aid in pain relief. The nurse bases a response on the understanding that this therapy is commonly contraindicated for clients with which of the following? 1. Ruptured membranes. 2. Multifetal gestation. 3. Diabetes mellitus. 4. Hypotonic labor patterns. The correct answer is 1. Some primary healthcare providers do not allow clients with ruptured membranes to use a hot tub or jet hydrotherapy tub during labor for fear of infections. Assessment of a 15-year-old prima gravida client at term and active labor reveals cervical dilation at 7 centimeters with complete effacement. The nurse should assess the client for which of the following first? 1. Uterine inversion. 2. Cephalopelvic disproportion. 3. Rapid third stage of labor. 4. Decreased ability to push. The correct answer is 2. Adolescent pregnancy carries an increased risk of pregnancy-induced hypertension, iron deficiency anemia, and CPD. To determine whether a prima gravida client in labor with a fetus in the left occipital-anterior position is completely dilated, the nurse performs a vaginal examination. During the examination, the nurse should palpate which of the following cranial sutures? 1. Sagittal. 2. Lambdoidal. 3. Coronal. 4. Frontal. The correct answer is 1. The sagittal suture is the most readily felt during a vaginal examination. When the fetus is in the LOA position, the occiput faces the mother's left. After the birth of a viable neonate, a 20-year-old primiparous client comments to her mother and the nurse about the baby. Which of the following comments would the nurse interpret as a possible sign of potential maternal-infant bonding problems? 1. He's got my funny-looking ears. 2. I think my mother should give him the first feeding. 3. He's a lot bigger than I expected him to be. 4. I want to buy him a blue outfit to wear when we get home. The correct answer is 2. Avoidance, hostility, or low-key passive behavior toward the baby may be a cue to potential bonding problems. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNurseGuide.com. Back to the questions. For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion. 2. Chills and fever. 3. Fluid overload. 4. Meconium-stained fluid. The correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, the nurse should monitor the client for signs of exhaustion as well as dehydration. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as the purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which interventions should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. An elderly client was prescribed Ativan 1 mg 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she has been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls the nurse to report her mother's behavior. Which of the following would the nurse suspect as the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? 1. Increase the client's confusion and disorientation. 2. Cause the client to become sad. 3. Decrease the client's feelings of isolation and loneliness. 4. Keep the client from participating in therapeutic activities. The correct answer is 3. Reminiscing can help reduce depression in an elderly client and lessens feelings of isolation and loneliness. In addition to developing over a period of hours or days, the nurse should assess delirium as distinguishable by which of the following characteristics? 1. Disturbances in cognition and consciousness that fluctuate during the day. 2. The failure to identify objects despite intact sensory functions. 3. Significant impairment in social or occupational functioning over time. 4. Memory impairment to the degree of being called amnesia. The correct answer is 1. Fluctuating symptoms are characteristic of delirium. Which of the following should the nurse expect to include as a priority in the plan of care for a client with delirium based on the nurse's understanding about the disturbances in orientation associated with this disorder? 1. Identifying self and making sure that the nurse has the client's attention. 2. Eliminating the client's napping in the daytime as much as possible. 3. Engaging the client in reminiscing with relatives or visitors. 4. Avoiding arguing with a suspicious client about his perceptions of reality. The correct answer is 1. Identifying oneself and making sure that the nurse has the client's attention addresses the difficulties with focusing, orientation, and maintaining attention. Which of the following interventions would be most likely to prevent the development of acute respiratory distress syndrome. 1. Teaching cigarette smoking cessation. 2. Maintaining adequate serum potassium levels. 3. Monitoring clients for signs of hypercapnia. 4. Replacing fluids adequately during hypovolemic states. The correct answer is 4. One of the major risk factors for development of ARDS is hypovolemic shock. Adequate fluid replacement is essential to minimize the risk of ARDS in these clients. A client diagnosed with acute pancreatitis 5 days ago is experiencing respiratory distress. The nurse should report which of the following to the healthcare provider? 1. Arterial oxygen level of 46. 2. Respirations of 12. 3. Lack of adventitious lung sounds. 4. Oxygen saturation of 96% on room air. The correct answer is 1. Manifestations of adult respiratory distress syndrome secondary to acute pancreatitis include respiratory distress, tachypnea, dyspnea, fever, dry cough, fine crackles heard throughout lung fields, possible confusion and agitation, and hypoxemia with arterial oxygen level below 50. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client is admitted to the emergency department with a headache, weakness, and slight confusion. The physician diagnoses carbon monoxide poisoning. What should the nurse do first? 1. Initiate gastric lavage. 2. Maintain body temperature. 3. Administer 100% oxygen by mask. 4. Obtain a psychiatric referral. The correct answer is 3. Carbon monoxide poisoning develops when carbon monoxide combines with hemoglobin. Because carbon monoxide combines more readily with hemoglobin than oxygen does, tissue anoxia results. The nurse should administer 100% oxygen by mask to reduce the half-life of carboxyhemoglobin. A client has developed a hospital-acquired pneumonia. When preparing to administer cephalexin 500 milligrams, the nurse notices that the pharmacy sent cefazolin. What should the nurse do? Select all that apply. 1. Administer the cefazolin. 2. Verify the medication prescription as written by the physician. 3. Contact the pharmacy and speak to a pharmacist. 4. Request that cephalexin be sent promptly. 5. Return the cefazolin to the pharmacy. The correct answers are 2, 3, 4, and 5. One of the rights of drug administration is right medication. Cefazolin was not the medication prescribed. The pharmacist is a professional resource and serves as a check to ensure that clients receive the right medication. Returning unwanted medications to the pharmacy will decrease the opportunity for a medication error by the nurse who follows the current nurse. The parent of an infant with a cleft lip and palate asks the nurse when the infant's cleft palate will be repaired. The nurse responds by stating that the first repair of a cleft palate is usually done at which of the following times? 1. Before the eruption of teeth. 2. When the child weighs approximately 22 pounds. 3. Before the development of speech. 4. After the child learns to drink from a cup. The correct answer is 3. The optimal time for a cleft palate repair depends on many factors. However, it is best done before speech develops and the child learns faulty speech habits as a result of the defect. After teaching the parents of a neonate diagnosed with a tracheoesophageal fistula about this anomaly, the nurse determines that the teaching was successful when the father describes a condition as which of the following? 1. The muscle below the stomach is too tight, causing the baby to vomit forcefully. 2. There's a blind upper pouch and an opening from the esophagus into the airway. 3. The lower bowel is lacking certain nerves to allow normal function. 4. A part of the bowel is on the outside without anything covering it. The correct answer is 2. Although a TEF can include several different structural anomalies, the most common type involves a blind upper pouch and a fistula from the esophagus into the trachea. When the infant returns to the unit after imperforate anus repair, the nurse should place the infant in which of the following positions? 1. on the abdomen with legs pulled up on the body. 2. On the back with legs extended straight out. 3. Lying on the side with the hips elevated. 4. Lying on the back in a position of comfort. The correct answer is 3. After surgical repair for an imperfect anus. The infant should be positioned either supine with the legs suspended at a 90-degree angle or on either side with the hips elevated to prevent pressure on the perineum. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.